Hello, everyone. Welcome to another show of New Hampshire Citizens for Progress. Boy, New Hampshire was doing so good there. Our numbers were going down, the death rate was going down, and we're no longer there anymore. We're back to being in the group of states that these things are getting worse. This thing, little mask here, I wear it not to protect me, but to protect those around me. I do it voluntarily. It's not a big deal. Okay? You grew up in New England. You've been outside in the cold. You got this mist, this fog around you. That's atomized droplets, water vapor. This virus is on that water vapor. This mask does not protect you against the virus. What it does is protects that water vapor, those particles, from you aerating all the air around you for people to breathe. This isn't going to kill you. This isn't going to interfere with your breathing. I'm an electrician. I have to wear these things. This is a mask. This isn't a respirator. It's particles. You can prevent the spread of this virus, or, for the most part, reduce the spread of this virus. We don't need to be experienced in this, and this is a real simple solution. Well, now that I'm finished with that, we have a gentleman here with us. He's an insurance broker, provides Medicare insurance to people in the state of New Hampshire. And are you disabled? Have you gotten older? Are you going to be getting Medicare? Are you old enough already and you do have Medicare as your insurance? How can you get the most coverage for you and your family via Medicare? Bruce, would you introduce yourself and give us
Absolutely, Rick. First, I want to say thank you very much for having me here. I greatly appreciate it. My name is Bruce Royer. I own an agency called Senior Benefit Services of New Hampshire. What we essentially are is we are Medicare brokers or agents. We're actually Medicare health plan specialists. And what differentiates us from the rest of the agencies out there is that we contract with all the major carriers in the state of New Hampshire for the main reason that we do not work or cater to one specific insurance carrier. Basically, we cover them all. What that allows us to do is it allows us to be able to give these people a wide array of options when it comes to the Medicare choices. So essentially, we work for the client. We don't work for the insurance carriers.
So if I was to make that simple, you represent the individual and you have the ability to point them to any and all insurance that they'd be able to use.
Yes, pretty much all of the available insurance carriers that offer all the available Medicare plans out there. So essentially there's 6 major carriers that we work with in the state of New Hampshire. They all have about 5 or 6 plans each. Currently, we offer 33 different plans in the state of New Hampshire for the coming 2021 AEP season.
I know when I went to Medicare, I have Medicare, that I went to it, a lot of things, you had to know what medications you had, what doctors you were seeing, and different plans would cover different things, so that was part of finding out the best plan for you.
Yes, when it comes to Medicare Advantage plans, which are a different option, there's 2 options in Medicare. When it comes to Medicare Advantage plans, there are a lot of moving parts to these plans. So you really need to know specifically how to research the plans. I call it the Medicare funnel. We start off with your prescription medications. We look at your doctors, your hospital, your networks, and then we look at things, benefits, and the features of the plans that will actually be able to assist you or help you get more out of your Medicare Advantage plans. So, Rick, essentially there's 2 options in Medicare, so to speak. There's option 1, and there's also option 2. Now, option 1 starts off with original Medicare. This is where everybody begins. With option 1, you have your Part A and your Part B. Now, Part A covers your hospitalization, and it is free if you've worked 10 years or more Okay, so you don't pay for it, but yet if you do get hospitalized, there is a $1,408 deductible that you're responsible for. Now, Part B, you do pay for, and currently is $144.60 per month. This, too, has an annual deductible currently of $198 per month. And this covers up to 80% of your medical costs. Now, there is this gap of insurance, so to speak, that they refer to all the time. And this is where people will pick up what they refer to as a Medicare supplement policy or a Medigap policy. These are interchangeable terms. Tomato, tomato, they mean the exact same thing. Now, in addition to
they refer to this as a donut hole as well?
well, the donut hole refers to the Part D portion of the option one, and this is where you have a standalone drug plan. So Medicare supplement policies are only medical, and the prescription drug plan is a standalone plan. And the donut hole applies to this here. If you have expensive medications that you end up taking on a regular basis, usually what will end up happening is that people will fall into this donut hole. It's a term that they use for the financial cost that is involved once you've had reached a certain level of cost between you and the carrier with your prescription drug plan. And we can get into that a little bit more in a little bit
Okay.
as well. So this is what I refer to as option one. Your primary insurance is original Medicare. Your secondary insurance is your supplement, and then you'll have a standalone drug plan. What everybody sees on TV and you're inundated with by mailings and constantly, hit with a barrage of commercials on TV is option two. Now, option two is what they refer to as Medicare Advantage plans. These work differently. And how these work is what they do is they take Part A and then they take your Part D. And for the most part, they always build Part D into it. They roll it into a package, and they call them Part C plans, otherwise known as Medicare Advantage plans. Now, what a lot of people don't understand with Medicare Advantage plans is that Medicare Advantage plans are literally replacement plans. And they call them replacement plans because a Medicare Advantage plan literally replaces your original Medicare.
So I have an Advantage plan.
Yes.
And when I looked at my plan, some of the things I wanted to include was like my hearing aids, transportation to and from facility.
Yep,
I
so-
had a health club.
Yep. So Advantage plans do have some additional benefits to the plan. But what makes them replacement plans and why they're replacement plans is because Medicare takes the premiums from your Part A that you've paid into all your life and the premiums that you're currently paying into Part B. And what they do is they give it to the insurance carrier, whoever that may be. And they say, here, you manage their health care plan going forward. So essentially what Medicare has done is they've given the money over to a private insurance carrier to outsource it. Now, these plans here are regulated and funded by original Medicare. So a Medicare Advantage plan can never offer anything less than original Medicare, but they can offer more. And that's where those additional benefits that you were just talking about, such as the dental, the vision, the hearing aids, come into play with the Medicare Advantage plan.
One of the other things that they give me over-the-counter
Yep.
expenditures for things like that aren't prescription.
Nope, yeah, exactly. That's another one of the benefits that comes with a Medicare Advantage plan. Medicare Advantage plans work a little differently than supplement policies. See, when you have a supplement policy, basically you pay that premium and they pretty much cover all the cost of your medical. With Medicare Advantage plans, they're really low-cost plans, but the reason why they're low-cost plans, and when I say low cost, they can range anywhere from literally zero premium, like you see them touting on those commercials all the time, zero premium plans, you don't pay for the plan, up to about $50, $60, on average amongst all the plans and all the carriers. The reason why is because they're cost share plans. So you're actually sharing in some of the cost of your medical expenses with these plans in the form of co-pays. Usually doctors, diagnostic tests, procedures, lab work, inpatient hospitalization, things of that nature.
So one of the things I experienced, I mean, I was a union electrician, so when I was working, I had pretty good insurance. But my wife's been a cancer patient for over 29 years. So I actually spent my life working for hospitals, pharmacies, and doctors. I mean, my copay on a doctor was $20, but she saw 5 doctors in a month, you know, and that's not including when I first got into the union, our cost on pharmacy was 5, 10, 15, you know.
And that's a really good point. So one thing that people may or may not realize, and they try to get it out to the public as much as possible, is that there are financial assistance programs that are out there that are available to almost everybody. And typically they're income-based. So for example, with the Medicare Advantage plans, because they have the prescription drug built into it, what they have is what is referred to as extra help with Part D prescription drug coverage. Now, this is a program that's run through Social Security, so anybody can apply for it, and it's income-based. Currently, the threshold is $1,595 or less. So if you collect less than that gross, now it hits the bank, gross, and that's including all incomes and pensions and everything earned, you would qualify for the extra help program, okay, for Part D coverage. And it does 3 things, the Part D extra help. The first thing it will do is it will eliminate the premium for the Part D drug plan. The second thing it will do is it will pick up the deductible. This year it's $435, next year it's going up to $435. It's a big chunk of money to have to pay for your prescription medication, as you were pointing out. And the third thing it'll do, it will lower the co-pays on your prescription medication when you go to the pharmacy. So your co-pays will end up being as little as $1.30 to $3.90 for the generics, and for the name brand drugs, it won't go any higher than $8.95.
So one of the things that I experienced was I qualified for what they called low income.
Mm-hmm.
Like I said, I've spent all my money and everything on insurance, doctors, hospitals for over 30 years. And my wife's still a cancer survivor at this point. She might not be a treatment survivor, though. That's a whole nother issue. But I've spent most of my income towards health care throughout my life. So I didn't accumulate a lot of money. So I qualified. They referred to it as Quimby. I had to apply for that through the Department of Health and Human Services
Yes.
of New Hampshire.
Yeah, really good, great point too, Rick. So the Quimby program that Rick is referring to is it derives from the Medicare Savings Program. So the Medicare Savings Program, again, is an income-based program, and there's many layers and levels to it, but we'll hit on the first 2 main ones that are most important. So one of the first ones that you can apply for and qualify for is called SLMB. It's an acronym. It's SLMB. It stands for Specified Low Income Medicare Beneficiary. What this program does is it will pay the Part B premium on your Social Security benefit for Part B. Okay, this is what you see on the commercial all the time, but again, it's income-based. So currently you have to make less than $1,456 in the state of New Hampshire to qualify for this program. Now, the other program that you were talking about was Quimby, and Quimby's another program with the Medicare Savings Program, and Quimby stands for Qualified Medicare Beneficiary. And what that program does is it not only pays the Part B premium, but it also picks up all the co-pays and deductibles with the plan. So what that means is that when you have a Medicare Advantage plan and you have Quimby, any of the co-pays that come along with the plan, the Quimby will pick up those co-pays and deductibles and cover the costs of them. So you don't have any out-of-pocket medical costs. And usually with what they call Quimby is what they refer to as dual plans. These dual plans bring in the additional benefits that they tout on TV all the time. The enhanced dental, the vision, the hearing aids, the transportation benefit, The over-the-counter, which you had mentioned, the over-the-counter is simply a spending allowance, typically a monthly or quarterly spending allowance that you get to spend on non-drug items at the pharmacy. So things like toothpaste, toothbrushes, vitamins, supplements, cold cough medicines, first aid supplies, pain relievers, ibuprofen, Tylenol, compression stockings. There can be a wider range of different options as well. They usually have some of the carriers have some very extensive catalogs regarding OTC benefits.
So basically, I think if you're having trouble with your cost of your health, apply for assistance from the Department of Health and Human Resources. And the worst case, they'll say, no, you don't get anything. I'm sorry. And they'll tell you why. You also get the right to object to it and appeal that decision. But if you don't apply for it, you're not going to know whether you qualify or not. So, like I said, the worst case, they're going to say no. Hey, they might even help you and make these costs. We get older. I'm not like I was when I was 20. Fall off a motorcycle at 55 miles an hour, jump up off the ground, and pick. Is the bike okay? Screw whether I was okay or not. I was okay. I'm a little bit older now. I'm not sure if I can bounce off the pavement at 55 miles an hour anymore.
And that's one of the things so trying to navigate, I call it the Medicare maze, and it literally is a maze, and people get lost in the maze and they don't know how to navigate through it. So one of the things we do here at Senior Benefit Services of New Hampshire is that we help people navigate that maze. So when you're trying to find out if you qualify and how to apply for these programs, we kind of walk you through it. We handhold you and we assist you on how to get there. We do many things besides just do Medicare. We advocate for our clients. We help them. We educate them, explain to them how Medicare works, and then we explain to them how these additional benefits that are out there or these additional programs out there can help them, reduce their medical cost and their out-of-pocket expenses. In addition to that, we're your broker for life afterwards. So basically, you're not out there flying solo anymore. You actually have an agency that's going to be there to help advocate for you. You have issues with your prescription medication. You get a bill in the mail you don't understand. You've just got questions about Medicare. You see another Joe Namath commercial on TV that you want to know more about. Then pick up the phone and call us, and that's what we're here for. We're here to sit there and serve these people because, as I said before, we work for our clients. We don't work for the insurance companies.
One of the things that you made me aware of in talking with you was that there's no one size fits all. You can't just say this is the best plan there is. It depends what your expenses are and where they are right now, who your doctors are, what medications. This gentleman's able to find the best fit, and because he represents all the insurance companies, he really represents you and can make all the insurance there is available to you. He spends the time and effort to find the one that fits your needs the best.
Rick, that's a phenomenal point, and I'm glad you mentioned that because exactly as Rick had said, there is no one size fits all. Medicare's a shoe fit. So when you're looking at Medicare options, and I find this happen to me constantly when I'm dealing with the high rises and the senior housing centers, that Mrs. Smith will come down and turn around and go talk to Agnes and say, Agnes, you need to get on this program because this is the best plan out there. And Agnes will call me up and say, well, why didn't you put me on that plan? And I explained to her, simply, it's like, Agnes, the plan that I put you on was the best plan for you at the time because that's the plan that fit your needs. What Mrs. Smith has is the best plan for her. There is no one size fits all in this industry, and there never will be because you're going to have different prescription medication, you're going to have different doctors, specialists. There could be a whole slew of different reasons why that plan was the best option for you and not the best option that Mrs. Smith has. So don't get that misconstrued when someone comes over and says that's the best plan. Well, there's no such thing as the best plan in Medicare. It's the best plan that fits your specific needs, not theirs.
Bruce, I think you brought up an important point. You said, for you at that time.
Yes.
People can change their plans. I mean, because I'm on the low income, I believe that allows me to change my plan quarterly. So I actually can run up all my benefits in one carrier, and then I can switch to another. Well, let me go a little bit further.
Yep.
I'm a step further than that. I get the QMB.
Yes.
The QMB actually allows me to change my plans monthly if I chose to.
Actually, that was true as of last year. They switched it last year and they made it quarterly now. So now they allow you to change your plan every quarter, where it used to be every single month. But the point that you had brought up before that, which was an extremely valid point, is that your Medicare needs now may not be the same needs, okay, 2 years from now, 5 years from now, or even later. And the fact that these plans do change. So just to be realistic, New Hampshire is a very small populous state. We don't have a large population here, so Medicare Advantage plans have just started taking hold. When I got into this business, we had a penetration of about maybe 7% into the population, which means out of 100 people who could be enrolled in a plan, that was it. We're actually about 15%, which is still incredibly low in relation to other states around us, which are at 35 to 45%. But what that means is, as more people enroll into the plans, there are more monies coming into these plans. More monies mean more benefits. And just in the last few years, I've seen a great big difference in the plans and the options that are out there. So plans will change, and some plans will take the lead in the pack. And what I mean by that is that they'll be bringing those additional benefits that enhance your life so much better than some of the other older plans that are still out there.
Yeah, one of the difficulties I had Anthem Blue Cross Blue Shield Advantage plan, and they ceased making that plan available in New Hampshire. And I actually didn't find out about it till I went to, they changed it January 1st. And I went to go to a doctor's visit, and I called up transportation, and your plan doesn't come. Well, it did when I got it. And that's how I found out the plan changed.
Right. And so it is typical that plans will change, eliminate some of their benefits. They'll pull the plan sometimes. They'll pull out of a county sometimes. Having a Medicare broker there, what we do every single year is we do a broadcast. We turn around and we'll send out a broadcast text to all of the clients in that specific plan saying, these are the changes in the plan. In addition to that, what we do is we actually send out a voice broadcast also. It would be in my voice telling you that, this is Bruce, I'm the agent that helped you enroll in that plan, and these are the changes that are upcoming for the year 2021. We have a specific line that we dedicate just for return calls. So when clients want to return a phone call, they'll call this line, they'll leave a message, we let them know, there's going to be a day or so before we get back to you, but we'll get back and follow up with any of your questions and any of your needs and contact you and let you know what's happening. If something's changed or something's happened, we will assist you in walking you through the change process and finding something that's going to suit your needs.
So I'm going to cover something, one of the troubles I had, it will probably be the last topic we can cover, is I have the QMB. I'm not supposed to be billed from any other person for medical coverage, and these companies, they keep sending me these letters that I got to bill them. Why am I having this difficulty when it says my program that I don't have to do that?
So it's typical, and what ends up happening is that, as I was explaining before when I was showing you the chart, you have option 1 and you have option 2. And when you have a Medicare Advantage plan, as I had said, it's a replacement plan. So typically what we find is that the billing offices will end up billing out the original Medicare, and it comes back declined because of the fact they don't have original Medicare anymore because Medicare has outsourced it to that private insurance carrier. So what ends up happening now is that the medical provider will go to bill out the next source, which would be the insurance carrier they have on file. They'll bill that out, and there's still those co-pays that we were talking about, and they don't think or realize that this individual may have additional benefits through the state Medicaid system that never gets billed out. So then they balance bill the individual. The problem with that is for one, they don't balance bill out the correct entity, which is the Health and Human Services or the Medicaid office, that should be receiving the billing. And second, by law, you are not allowed to balance bill somebody who has Quimby. So if you are a qualified Medicare beneficiary, Medicare states that you cannot be balance billed. In other words, they cannot send you a bill by law. So they either have to write it off or they have to submit that bill to Health and Human Services to collect payment on it.
And that seems to be where the confusion is, because the only thing I get is I get a monthly statement of what I'm receiving from Department of Human Services.
Yep. Yeah, and if you're not specifically telling the provider that you have a Quimby program or you have the Medicaid, they may or may not know to bill it out, and that's a common mistake too. But again, this is something that we will guide people to and assist them with, so they understand the proper channels and how to sit there and deal with this, because it is confusing. There are a lot of moving parts involved in this, especially when it comes to the billing. And of course, there's so many different insurance carriers out there. It becomes, again, another Medicare maze, even for the medical providers trying to bill out these insurance programs.
Well, Bruce, I want to thank you very much for coming in and spending time with us and explaining what we can do to make our healthcare costs more affordable, and how to be proactive and getting the best coverage that we possibly can. I thank you all for joining us and seeing another show of New Hampshire Citizens for Progress. Hope to see you next week. Take care, be well, be healthy. Thank you.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.